ethical debate, use of punishment. Our group chose to do a formal debate on the use of punishment and applied behavioral analysis. I'm Elisa, and I'll be the moderator. We have Molly and Kaylee arguing for the use of punishment, and Anna and Robert against. Our dilemma is the ethical use of punishment in ABA. For decades, one of the most polarizing topics discussed has been the use of punishment to help suppress undesirable behavior. From an applied behavioral analysis perspective, punishment occurs whenever a stimulus is applied subsequent to the occurrence of a behavior and the behavior's future probability decreases. Most practitioners have a set side that they stand on when considering punishment procedures. Advocates claim that it is but one of the many methods to reduce harmful behavior. They emphasize that punishment is a last resort and that its use must adhere to explicit application guidelines. In contrast, critics argue that punishment is dehumanizing and is never justified. These statements bring to surface many questions as to who is right when deciding on controversial treatment methods. Here today, we will bring you both sides.
The effects of punishment have been studied for decades. There have been countless studies performed on how the use of punishment controls behavior. Punishment techniques have been shown to be effective in reducing problem behavior within clinical populations. In addition, research studies have found that punishment is not only effective, but it can be critical to a treatment plan, and in some cases even preferred by the client. Hanley and colleagues completed a research study using reinforcement and punishment techniques with functional communication training with 2 students. Their study found that when functional communication training was used alone, the problematic behaviors observed decreased below baseline level. However, when the researchers used punishment in conjunction with functional communication training, the problem behaviors not only decreased, it approached near zero levels of problem behavior. Another study incredible results for punishment-based procedures. This study, completed by Hagopian and colleagues, looked at a compiled list of 21 different clinical case studies. Their research shows that only 1 out of 10 applications were successful when the problem behavior and alternative behavior both resulted in reinforcement. But most importantly, their study found that 17 out of 17 applications were successful when functional communication training was paired with a punishment component. Interestingly, Lorman and Vorndran argue that many popular function-based interventions are rooted in punishment, thus making them effective. An example being differential reinforcement. Differential reinforcement is a contingent loss of reinforcement. They argue that techniques like these could possibly be considered a form of punishment.
Thank you, Molly. Despite that punishment has been used as part of the treatment program, it's critical more research in this area. I can mention some considerations why. According to Lehman and Broadman, 2002, they say that the effect of the punishment is most of the part has been observed in laboratory with non-humans, and for this reason leads to limitation because it's not sufficient enough evidence in humans. A lot of gaps in immunology is noticed too. The generalization of the punishment procedure cannot be implemented in other alternative settings. For example, I can mention the research of Bimbro, 1998. He said that additional training was needed when the research trying to replicate the punishment effect in controlling variables stimulus in another different settings. And was necessary multiple stimulus exemplar, such as mean is not a specific change in a diverse environment. Other critical rounds from this literature express that during the punishment procedure, therapists cannot pair the punisher with naturalistic consequence. We're concerned about another critical point that the primary funding of punishment at the clinical population level is questionable because of the adverse effect that may cause. We can find, all this part in Lehman and Broadman in 2002. The use of the punishment also could cause negative and irreversible consequences in humans. That will lead to high cost of part for the treatment also. The need for more research in this area could lead to failing in the efficacy of intervention because of the lack of scientific support that is needed for replication. The lack of human experimentation, the use of invasive procedure without the necessary literature support, and this is why it's a con with the morality of the replication.
Punishment may be vital to the success of treatment when the maintaining variables of problem behavior fail to be controlled or identified. Also, punishment may be superior to reinforcement-based treatments when there is a need to suppress the behavior immediately in order to prevent physical harm. Punishment has leverage over functional analysis methods in situations where the response-reinforcer relation cannot be fully eliminated. Punishment is a vital tool in treating problem behaviors that have failed to be identified and controlled, and the use of reinforcement practices have been exhausted and unsuccessful. There are basic findings that suggest reinforcement parameters can greatly influence the effects of punishment in critical ways. Punishment has been proven effective in completely eliminating or decreasing the frequency of a behavior much more quickly than other methods, such as differential reinforcement. Results of research have shown that using a wide variety of punishers, whether it be verbal reprimand, water mist, removal of preferred activities, etc., can result in an immediate and ample suppression of problem behavior. Authors have stated that treatment with punishment is extremely effective because it has the ability to successfully compete with the reinforcing contingencies that maintain problem behavior. Although some studies have shown that prior exposure to the punishing stimulus can either contingently or non-contingently decrease a behavior's sensitivity to punishment, similar findings have found that in relation to intermittent reinforcement. The use of intermittent reinforcement is nearly impossible to avoid in the natural environment. Therefore, punishing stimulus, the more intense punishers may be needed to suppress the problem behavior. However, if milder forms of punishment are only used in careful consideration by parents and caregivers, then more intense forms of punishment can be avoided. Also, adaptation to the punishing stimulus can often be corrected by a brief interruption in the use of punishment. As it relates to reversing sensitivity to the punishing stimulus, the use of multiple punishment procedures, as opposed to a single procedure, can greatly minimize the potential possibility of becoming sensitive to any single punishment or punisher or procedure.
While research has shown that punishment can effectively ameliorate problem behavior, researchers have not fully extrapolated the environmental variables that can influence a clinician's behavior and extraneous variables that affect interventions. That is, by understanding researchers' and clinicians' qualitative characteristics, one may be able to predict the overuse and the reliance of intrusive procedures. For example, in a recent meta-analysis by Heineke and Carr in 2014, they found that when implementing skill acquisition goals, experimenters implemented 28% of the time, teachers did 24% of the time, and the therapists 13.5% of the time. However, for behavior reduction, that is punishment, procedures were carried out 26% by staff, 24% by therapists, and 14% by the experimenters. This suggests that there's a relationship between a lower educational status increasing the likelihood for intrusive procedures. Furthermore, researchers have delineated extraneous variables important for treating problem behaviors, such as functional pre-treatments that actually produce greater effectiveness than traditional behavior modification variables such as reinforcement or even punishment. The two most common forms of functional treatments are functional analysis, which is the experimental method to elicit behavior, which establishes cause and effects, includes the test condition, whereas the functional assessment is an inferential method that seeks to correlate stimuli related to behavior utilizing scatter plots and ABC recordings. Despite their methodological differences, these pre-treatments have been shown in research to be critical components of effective interventions. And similarly, Hastings and Noon in 2005 addressed the polarity between interventions based on either functional behavior or behavior modification type of independent variables, such as FBA and EFA may be considered as an antecedent independent variable, while consequential interventions such as reinforcement procedures and punishment procedures are referred as traditional behavior modification independent variables. For example, treating problem behaviors such as aggression and self-injury, research reports a robust effect size for analysis of function as a critical piece of treating these maladaptive behaviors. Despite their empirical support of functional pre-treatments, Heineke and Carthon support that functional treatments are not used before reductive behavioral interventions. Perhaps this is due to the expert understanding of functional treatments and the relative ease of the use of punishment.
It is critical for a behavior analyst to consider the strength and ability of treatments to transfer across settings for their clients. The use of punishment techniques have been found to have connections with maintenance, generalization, and valuable side effects. First, the study completed by Hanley and colleagues found that punishment contingencies not only reduced problem behavior occurrences to near zero levels, but they also maintained those low levels. Those contingencies also allowed for maintenance of alternative behaviors for both students in their study. Lerman and Vorndran state in their research that basic findings from the pioneers of the field like Skinner show that termination of punishment contingencies generally cause problematic behaviors to return to pre-punishment treatment levels. They also cite research by Duker and Sayes that concluded that out of 12 participants, 7 showed maintained behavior change once evaluated 36 months after the treatment, and 1 more participant after 47 months. Second, findings on generalization show that the effects of punishment treatments may generalize to untaught settings. Unfortunately, there is not a great deal of research into generalization with punishment treatments in order to give more than may be and could be statements. And finally, several authors have suggested that desirable side effects are more likely to occur than those that would be considered undesirable. Research suggests that this may be due to the fact that unpunished behaviors tend to increase when other behaviors are placed under punishment contingency. Those unpunished behaviors are then more likely to occur because those behaviors are not placed under contingencies. Again, there is not a great deal of research in this area of desirable to assist punishment procedures in not only decreasing the behavior that they are meant for, but also to decrease the behaviors that better benefit the individual as a whole.
Thank you, Molly. However, the sustainability of the treatment using punishment is a critical consideration for practitioners. Teachers and caregivers are other persons with working with destructive people and destructive behaviors. Some research, nevertheless, has suggested that the clinical effects of punishment are considered short-lived, especially when the treatment procedure remains unchanged over the time. In the same hands, other research showed that with both humans and non-human, various punishers have been associated with continuous response suppression under punishment, including relative intense levels of electric shock with pigeons and rats, point of monetary loss with normal humans, and then out from positive reinforcement with squirrel monkeys. The effectiveness of using punishment varies between non-human, and such is the case of the forest monkey, that they needed more time for positive response. This is mean that even the animals, no animals persons, need more time for get results for punishment procedure. So the effectiveness of using punishment varies both even with non-humans, such as the case I mentioned it before, and we can contrast with human behavioral complex, and we can predict that the same effect is not going to be the same. Our research also who endorsed this statement was Skinner in 1983. He said that when we involving electric shock, it can damage at the point of being put behind the initial point on the investigation. And at the same time, Skinner also suggested the behavioral recovery can be better if the level of punishment is less intense. So he make a comparison with high level of punishment and low level of punishment, and he noticed that when it lacks punishment, the behavior response is going to be more appropriate. So following determination of the punishment contingencies also generally show with the response. For example, the rats immediately returned to baseline, sometimes even temporarily exceeding the baseline data unless intense punishment were used. Other studies also suggested that the time used for experiment in a human was in some cases 30-minute to 60-minute punishment session across 10 to 20 days. So in this case, the procedure used in lab were very limited. And when it's replicated to humans, we can see that we need more time. We need to see more for the months, years, and see the replication system they're doing is gonna be. You're gonna stay with the people with the behavior problem. Aggression also was noticed in the replication process, and this is why the phenomenon is also called punishment elicited aggression. Few studies do the intensivity who limited the generalization or application. For example, in the study of Hudson, 1997, we can find the punishment was implemented using some invasive technique in a human, and in this case, the rat and pigeon, attacking neurologic subject, biting, in a mate is associated with not continuous delivery of an avoided stimuli.
Although research on the effects of punishment has stated that punishment can result in increases in aggression, escape behavior, and emotional reactions, there's actually little research studying these side effects of punishment. For example, punishment elicited aggression, a phenomenon that believes aggression will occur when a non-contingent, unavoidable stimuli is delivered, has very few studies supporting or examining this side effect. However, there are findings that suggest elicited aggression is less problematic during punishment than it is believed to be. Reason being, the punishing stimuli can be escaped by refraining from engaging in the punished behavior. Punishment of problem behavior has been associated with increases in appropriate behavior and decreases in unpunished, inappropriate behavior, such as crying or aggression. Although some have argued the opposite effect, many authors have suggested and agreed that the desirable effects of punishment are more likely to occur than the undesirable effects. The safety and efficiency of treatment can be greatly improved in precursors to dangerous behaviors if the precursors to dangerous behaviors are identified, because this can aid in collateral reductions in the severe behavior. The collateral reduction of appropriate behaviors can be avoided by arranging reinforcement for this behavior under stimulus conditions that are noticeably different from those that are present when the punished behavior occurs. For example, modifying the environment or introducing reinforcement in a different or new setting can be useful strategies to change stimulus conditions and avoid the reduction of appropriate and desired behaviors. In relation to this, alternative reinforcement needs to be available for multiple responses across various settings and contexts.
Maintenance has been, pretty difficult to document in the research literature due to the nature of publishing journals. However, limited research has, been completed with follow-ups that have explicated treatments and interventions that produce long-lasting effects. In an attempt to verify which procedures would be most effective in decreasing self-injurious behaviors and maintaining the results, Duran and Carr in 1992 implemented one treatment group with functional communication treatment and the other group with timeout procedure. While both functional communication training group and the timeout group were equally effective in reducing challenging behavior, it was the FCT group that did not regress to their previous levels of challenging behaviors in the presence of a novel teacher condition. This was not the case for the timeout group. When the timeout group was assigned to a different teacher who was unaware of previous treatments, an increment of challenging behaviors occurred. Analogously, Brosman and Keeley in 2011 reviewed available literature pertaining to behavior interventions that have shown to treat aggression. Of the 18 studies that met the criteria for inclusion of studies, 5 did not even use a functional assessment, and the other 13 used a sort of a variation of functional analysis. Of those 5 out of those 13 studies were not able to determine function, and only 4 gave information on follow-up studies. And all 4 of them actually did indicate that the instances of aggressive were maintained to levels of 0 or at near 0. And all these four included a functional analysis, and only one out of those four included a timeout procedure with reinforcement.
Lorman and Vordran state in their research that punishment may be critical to treatment when the function of a behavior is uncertain or uncontrollable. They also state that punishment techniques may possibly be preferred over reinforcement strategies when problematic behavior needs to be decreased quickly in order to keep the individual safe. Reason being, many studies have found that treatments that have come from functional analysis do not always reduce problematic behaviors to acceptable levels without some form of a punishment component. This is supported by the Compliance Code 4.08c, stating that punishment procedures are required if the problematic behavior is severe or dangerous to the individual and necessitates immediate intervention. It is also argued that by Lerman and Vordran that some popular function-based treatments have components of punishment strategies, but more on that in the next section. It is worth mentioning here that they also express their views on the intensity of use punishment. They cite several studies that found that increasing the punishment over the length of the punishment was shown to be ineffective for the individual. For this reason, the authors caution practitioners against increasing the intensity of the punishment over time. And instead, they recommend using punishment consistently in moderate to high intensity levels. However, it has been shown that small intensity punishment can be effective if the punishment originally starts in high magnitude and is slowly decreased over the length of the treatment, and then ending with a smaller magnitude. Smaller intensities of punishment can also be very effective if the punishment is delivered immediately following the behavior.
In the application process, especially when practitioners need to know the effectiveness of the intervention, it is necessary to provide enough evidence that the study have enough social validity and the reduction of the behavior problem can be addressed without enough scientific support. But unfortunately, some authors are not on the same page. Yes, it's not library or unfortunately in the punishment procedure. We can find that argument in the article for Donella and Lavina, 1990. We can assume for decades we not enough evidence support that validate the use of punishment procedure. Punishment procedure can leave harmful effect for all the cases when the destructive behavior cannot be controlled and suppressing conduct could make the case worse, in some cases irreversible. This is why it's extremely necessary that further evaluation as well compile all necessary scientific support before to start the punishment intervention and make a complete evaluation of literature review and determine the treatment after enough valuable evidence or not. In the literature, we can find other research articles, for example, Wada, Pace, and Dors in 1994. Indoors that more than 1 decade ago has been shown that the functional behavior often can be determined, and that this information can be used to develop treatment based on extinction reinforcement and other processes, such as establishing operation. Nevertheless, another research like Axelrod Ariwara, 1990, they say that punishment can be critical to treatment success when the variable maintenance problem behavior cannot be identified or controlled. So punishment without scientific valid evidence could lead a worsening of the mental health of an individual with destructive behavior.
Reinforcement, when used in conjunction with punishment, has a much greater efficiency than the use of reinforcement alone. For example, a study found in one article in the Journal of Applied Behavior Analysis found results strongly supporting the claim that efficiency of reinforcement is much greater when used in conjunction with punishment. The study found that when using functional communication training combined with punishment for severe problem behavior, 17 out of 17 applicants were successful. Success, for the purpose of this study, is defined as a reduction in problem behavior by 80% or more. In contrast, when functional communication training was combined with reinforcement alone, only 1 of 10 applicants were successful when problem behavior and the alternative behavior both resulted in reinforcement. The more desirable results of combining functional communication training and punishment supports that functional communication training plus punishment is more effective at reducing problem behavior?
While it may be easy to accept the notion that punishment is necessary under some conditions in which remediating behavior through function is inconclusive, as stated earlier, research has also shown that adequate use of functional treatments largely depends on expertise from practitioners. In fact, level of expertise has shown to predict the use of intrusive methods before even implementing an EFA or FBA. Similarly, when closely examining the most effective components of behavioral decrements when implementing either an FCT or punishment, Durant and Carr found that while both of those were initially reduced to 0 from both treatment groups, it was only the FCT group that maintained near level zeros. As a result, FCT can be considered the more critical component compound treatment, which as a result can't be really utilized without a functional pre-treatment. Moreover, when examining effective treatments in ABA, it is also essential to consider the function and the topography. For example, Rosen and Healy reviewed the scientific literature to identify most effective interventions for aggressions. They found 3 main findings. That EFA and FBAs both improve the likelihood of behavioral reductive interventions. They also found that aggression only decreased when both severe and less severe behaviors were published similarly, and that 1/3 of the studies did not conduct a functional pre-treatment. Along with research on effective treatments for aggressive behaviors, Hastings and Noon conducted a meta-analysis for self-injurious behaviors. They found that functional assessments maintained effects when interventions were removed. Groups that received punishment did not. However, Hastings and Noon stated that the use of intrusive procedures can only be justified if the SIB can be described as a quote-unquote life-threatening effect. But overall, more than likely, punishment procedures are used not because of such life-threatening conditions, rather due to skill level and convenience. The ethical concern is that punishment is always due to variables related to the implementer and not variables that are pertinent to treatment, such as adherence to scientific research and ethical guidelines.
Compliance Code 2.09a very clearly states that clients have a right to effective treatment that is based on research literature. The same compliance code also places behavior analysts under the obligation to educate the client about scientifically supported treatment procedures that would be the most effective. Given these compliance codes, one could argue the use of punishment procedures as not only ethical, but unethical not to implement. An article by Heron and his colleagues uses a quote by other fellow co-authors, Cooper and his colleagues, in their argument. The quote states that, from an ethical standpoint, it can be argued that since punishment can be used in a therapeutic way to suppress the future occurrences of maladaptive behavior, not using punishment, especially in situations where other punishment or other procedures have been tried unsuccessfully, withhold a potentially effective treatment and maintains the client in a dangerous or uncomfortable state. Clients have a right to effective treatment. And if a punishment procedure has been found to be effective, nothing else has, behavior analysts have an obligation to implement those procedures into an effective treatment for their client. This also means that should a behavior analyst ignore a treatment effective simply on use punishment, the analyst is in non-compliance with the ethical codes. It is also important to note that clients or their caretakers have the right to consent for treatment under Compliance Code 9.083. This code also makes it an obligation of behavior analysts to provide informed options of treatment to the client or the caretakers of the client. That means that behavior analysts are obligated to disclose information about punishment procedures if treatment is considered to be an effective option for the problem behavior that is being modified. Again, not providing the client or caretaker with informed choices places the behavior analyst in non-compliance with the ethical codes.
Some ethical concerns could be take the right of the individual could lead to legal consequence because could be violated human rights. Every individual with disability or not has the right to choose what could be the more beneficial treatment before the intervention. Even if the individual doesn't have the mental faculty to make the decisions, caregiver, parent, or teacher have the right to choose and use a least restrictive procedure. The BCBA ethical compliance indicate in the Code 209 about treatment efficacy. In the Section 8, we can find clients have the right to effective treatment based on literature review and adapted to the need to the clients. And in the Code 4.08 we can find behavior analysts recommend reinforcement rather than punishment wherever is possible. For example, in the article of Dowden 1992 explained that ethical issues arise when consultants artificially limit consult choices. Analogous dependency, manipulations, and uses of power can easily occur when consultants work to persuade consultee to choose a specific goals, use a specific intervention, or continue consultation without freedom of choice. This we can find in the Dowden article. Also, parents, teachers, and caregivers can choose an intervention where it can be included reinforcement, not only be limited to use punishment alone. For example, in the article Agoping Study in 1998, they summarized the result of 21 clinical cases involving functional communication training as the primary intervention. Author from the functional communication training was successful when combining with punishment 7-7 application. The majority of the research about using punishment alone is not well accepted for this side effect of the intervention. In contrast, the using the punishment with reinforcing system can be the better treatment. The literature states that the least restricted intervention could be more efficacious in the treatment without produce negative and adverse effect in the individual. And OA suggests a least restrictive procedure.
One of the most important considerations for practitioners, teachers, and caregivers of those with behavioral disorders is the durability of treatment with punishment. Basic findings on the maintenance of response suppression after terminating the punishing contingency show that the response rates immediately returned to pre-punishment levels, or even greater, unless intense punishers were utilized. These results suggest that the intense punishers may produce lasting reductions in problem behavior when the punishment contingency remains in effect. Therefore, it is extremely important to have the best empirical evidence to support the treatment and ensure only the best quality and most systematic, effective technology of behavior change. There is a need for a better understanding of punishment processes. There is a need for literature to better emphasize the demonstration of control rather than analyzing controlling variables. In general, most studies have aimed their focus at procedural variations of punishment rather than focusing on the factors that affect punishment, whether directly or indirectly. There is a need for further research on a number of areas within punishment and treatments, including a punishment component, because there are many aspects of punishment that are being overlooked. It is stated in the Ethical Compliance Code 4.08 that when aversive procedures, behavior analysts need to ensure that an increased level of training, supervision, and oversight is present. Ethical Code 4.08 also states that behavior analysts must evaluate in a timely manner the effectiveness of aversive procedures and make modifications to the behavior change program if it shows to be ineffective. There should always be a plan to discontinue the use of aversive procedures when they are no longer relevant or needed. In order to provide clients with the most effective treatments and prevent them from harm caused by dangerous behaviors, punishment may be necessary if the previously implemented reinforcement-based procedures have failed. Ethically, if reinforcement-based procedures have been exhausted, then a punishment-based procedure is necessary in an attempt to decrease the dangerous behavior.
The role that a behavior analyst plays is to apply critical thinking with respect to both research and application in the community or clinical setting. More specifically, regarding punishment, researchers must begin developing first the ability to objectively describe stimuli and phenomena with accuracy and consistency with regards to different types of punishment, along with being more consistent in describing punishment. There are other statistical methods such as heterogeneous treatment effects that put special emphasis on experimenter and participant characteristics. That is, the purpose of heterogeneous treatment effects is to disseminate the propensity of how particular independent variables affect the dependent variables when accounting for various extraneous variables in the environment. Also, using meta-analysis, there is a new way to explore and factor in every variable that may play a role in successful treatment and include things such as participant characteristics, research characteristics, interaction effects, and correlations. Moreover, the role of a practicing behavior analyst is to first apply research findings such as applying functional behavioral pre-treatments to every case and to be aware of the need for adequate training and supervision of staff with minimal education. Also, a behavior analyst must be able to determine a scientific criterion where punishment must be considered life-threatening. In this condition, FBA and EFA procedures may be unethical due to eliciting dangerous behaviors or the time consumption that it takes to collect data. However, for non-life-threatening conditions, beginning treatments without implementing pre-functional treatments and using intrusive procedures is unethical and does not match the justification as a life-threatening condition.
Thank you, everyone. Well done. As we presented here today, there is enough empirical evidence to show the efficacy of programs with and without punishment. Some important considerations to remember when implementing programs that use punishment are to always adhere to the professional and ethical codes of compliance for behavioral analysts. Code 4.08c states that before implementing punishment-based procedures, behavioral analysts ensure that appropriate steps have been taken to implement reinforcement-based procedures unless the severity or dangerousness of the behavior necessitates immediate use of adverse procedures. Consent of any use of punishment must be given by individual or caretakers in all situations of use. Thank you.